Secretary of Health Dr. Faith Brebnor is confirming the activation of emergency mode at the Scarborough General Hospital is a normal procedure.
No, we do not have an outbreak of anything. Somebody asked me if we have COVID. No, it is nothing like that. This is really just a measure. It's a normal thing. I am sure if you actually ask quietly some of the RHAs in Trinidad, they would tell you they do it as well, but they probably don't make a public statement about it. We've made a public statement because we actually want people to be conscious of the fact that, if you do not need to go to accident and emergency, don't go up to Signal Hill. You could go to any of the health centers.
The release from the Tobago Regional Health Authority explained that wards are at maximum capacity, adult medical 33 and surgical 34 patients, with 13 patients awaiting admissions.
Emergency mode just means that the hospital will be focusing on critical issues. As it said in the release, if you are doing an elective surgery, for example, something that does not need to actually happen right now, we will ask you to put it off a little bit, probably until next week or a little later, because what we are experiencing is very high occupancy rates in the hospital. Our wards are filled to capacity, to the point where we've had people sitting in A&E who need to be admitted.
According to the release, every effort is being made to transfer stable patients to the Roxborough Hospital where limited bed space remains available. While some expressed concern, Secretary of Health Dr. Faith Brebnor also noted the emergency mode activation is a part of healthcare management.
So this is just a very short-term measure for us to kind of balance it out a little bit, to ensure that we get back to a space where we can manage the bed space that we have, and so that we could ensure that those people who need critical care, we are able to provide it to them.
The THA's Minority Council questioned whether this occurrence speaks to the absence of an emergency plan at the TRHA. However, Dr. Brebnor noted this decision is as a result of the division and TRHA's plan.
Well, the fact that we are putting the hospital under emergency is really because the plan is in place and we are rolling out the plan. What people probably don't recognize is that this is actually, we've been looking at the trends of our occupancy rates for the last couple of months. So this isn't something that just happened last night, by the way. We've been looking at the trends and it has been moving up. And what I've actually tasked the TRHA with is really putting together a longer term plan for us to treat with the fact that we seem to be having patients who are sicker, which means they have to be admitted, and when they are admitted, it means they have to stay on the wards longer.
The Health Secretary also encouraged citizens to take care of their health and adopt necessary precautions. Carissa Douglas, TTT News.
The Tobago House of Assembly's Minority Council believes the activation and announcement of emergency mode at the Scarborough Hospital is worrying. Via voice recording, Minority Leader Calvin Morris said there is a need for clarity and leadership in addressing this situation.
We need to understand what causes sudden surge in hospital admissions. Is it an outbreak, or are we facing deeper problems in our health system? Tobagonians are in fact asking these questions, and they deserve answers. The release gave no clear plan to manage the crisis. After going through a pandemic, we should have had a backup plan ready to support increased demand. Where is that plan now?
Mr. Morris also noted that the manner in which the situation was communicated could affect Tobago's tourism industry.
Visitors may now worry about getting medical care if they fall ill here, and I suspect many are already reconsidering their travel plans. I am therefore calling for three things from the Secretary of Health. First, a clear explanation of what is happening. Second, an emergency response plan with details on how patients will be cared for. And thirdly, open and honest communication to reassure both residents and visitors.
The minority councillor also questioned the Tobago House of Assembly's decision to spend millions to acquire property adjacent to the hospital when there are greater needs.